once one enters.
Hello, ladies and gentlemen. Good evening. Anyway, here's your wound and lymphedema bro. If you're using Aquacel AG, triad hydrophilic dressing, or some kind of hydrocolloid like the Comfil, and other wound care products like hydrogels, you may not realize that one of the common ingredient that's found in these products is carboxymethyl cellulose. The focus of our discussion today is carboxymethyl cellulose. What is it, and why is it that this substance is very popular in the making of wound care product today? Stay with me so that I will make you more informed and more knowledgeable about carboxymethyl cellulose and its role in wound care today. What is carboxymethyl cellulose? Carboxymethyl cellulose is one of the most important polysaccharide, and it is a chemical modification of cellulose. As you can see in this chemical structure, CMC is a modified cellulose. It is also known as cellulose gum, and it's commonly abbreviated as CMC. Its unique properties include number 1, biocompatibility, number 2, biodegradability, number 3, tissue resembling, and number 4, low cost, and number 5, non-toxic. CMC, because of its particular qualities like I just enumerated, is very popular in wound care, especially in the making of wound care products, because it plays an important role in the healing process. Here's a rundown of its function in wound care. Number 1, moisture retention. Carboxymethyl cellulose is hydrophilic and may absorb and hold moisture. Hydrophilic means water-loving. So this hydrophilic nature makes it possible to blend and cross-link with other materials, and it aids in the creation and maintenance of a moist wound environment, which is essential for wound healing. If you are a patient watching this, please know that a moist environment is preferred over a dry wound base for healing to proceed. And why is that? For cell migration, proliferation, and tissue regeneration to happen, there should be a moist wound environment. For this reason, CMC is often utilized in the production of wound dressings, hydrogels, and foam dressings. These dressings are intended to cover the wounds while also providing a moist barrier to keep the wound from drying out. Dressing based on CMC may help protect the wound from contamination, lower the risk of infection, and speed up the healing process. I mentioned about drying out. Always remember, ladies and gentlemen, that for a wound or for wound healing to proceed, like what I said earlier, you need a moist wound healing environment. Moist is moist. I didn't mean wet. When you say wet, is different from moist. Now, the second important role of CMC in wound care is exudate management. CMC may help regulate exudate levels in chronic wounds and also in wounds with excessive exudates. Like, say for example, a weeping wound from a chronic venous insufficiency, oozing a lymphedema, or in those with severe congestive heart failure. So it helps by absorbing and holding excess fluids, and this may help to keep the wound bed clean by preventing maceration of the surrounding healthy tissue. Let me just explain what is maceration. Maceration is actually the process of softening and breaking down of intact skin. Always remember that when a fluid, or especially when it is a chronic wound, the chronic wound fluid, once it attacks or invade an intact surrounding skin, it is so harsh and it's always free inflammatory that it could soak the intact skin and make it to soften and to break. Why, or in so what? Why is it that we need to prevent maceration? A macerated skin is, well, the skin will become a very weak barrier. It's no more vulnerable or susceptible to fungal or bacterial infection. And always also remember that if you are familiar with the healing process, if you have a full thickness wound, your hope to resurface the wound is an intact margin, because it's where the epithelial cells or epithelial tissue to grow before they could migrate inward to resurface the wound. The third role of CMC in wound care is its role in autolytic debridement. What is autolytic debridement? It is the natural process in which the body's enzyme or the body's fluid break down dead or necrotic tissue in the wound. Carboxymethyl cellulose may help remove non-viable tissue while conserving good tissue by maintaining an ideal moisture balance. Remember that for new tissue to grow, non-viable, devitalized, necrotic, or dead tissue must be removed because they occupy the space where the granulation tissue would form, or it serves as an obstacle for the migrating keratinocytes or the migrating epithelial cells trying to resurface. An insertion to this discussion is that as a wound care specialist, I see patients from 7 o'clock in the morning to 6 o'clock in the evening, and one of the most common issue that I deal with is wound pain, especially during dressing change and during sharp debridement. The carboxymethyl cellulose, as far as pain management is concerned, the moisture retaining characteristics of CMC may aid in the relief of wound pain and discomfort. So it keeps the wound from drying out and becoming crusty. Can you imagine when the wound dries out and becomes crusty? It may be very uncomfortable and painful for the patient. Now, I must mention that carboxymethyl cellulose is often utilized in the manufacture of gel-based or ointment-type wound care products like the Triad hydrophilic wound dressings. These gels are simple to apply and adhere to the contours of the wound, making them appropriate for a wide range of wound types and on difficult-to-dress wounds like pressure ulcers on the buttocks, diabetic ulcers in between the toes, and also in burn patients. I have a patient right now. She has a really extensive burn within the groin and also extend to the sacral area, and it's really difficult to dress. And I'm using Triad hydrophilic dressing, which has carboxymethyl cellulose as my primary dressing on this patient, and it's working really well. Other thing that I must mention, which is, I would say this is another role or value of carboxymethyl cellulose in wound care, is it's widely regarded as biocompatible and safe for use in wound treatment. So it is widely accepted by the body and seldom causes negative responses or allergies. That is the reason why, if you are, say for example, you are using Triad hydrophilic dressings, and during your second or your next dressing change, there are some of the Triad paint that it's really adhering to the wound base. You don't have to remove them. You just leave it there and put a new one because it's biocompatible, it's biodegradable, so to speak. If you're interested about evidence-based literature about carboxymethyl cellulose, these are a few that I can mention today. Number one, in the study conducted by Garrett et al. Published in 2009 using an animal model. The efficacy of CMC in promoting corneal wound healing was examined. It was concluded that carboxymethyl cellulose promoted dose-dependent corneal epithelial wound healing. Another one is that as the CMC forms are non-cytotoxic, and it supports fibroblast cell proliferation according to this study. The wound healing process using normal and diabetic rats indicated that pure carboxymethyl cellulose films are more effective in healing wounds than the blends with other products. The histopathological study showed that the films can promote reepithelialization by the formation of granulation tissue and collagen synthesis at the wound. Anyway, here's another study. In a study by Walker et al. Published in 2003 in the publication Biomaterials, detailed scanning electron microscopy techniques have demonstrated that the fluid controlling properties of carboxymethylated cellulose wound dressing like the Aquacel AG, which is a hydrofiber, and it was demonstrated that following hydration of the Aquacel, which contains carboxymethyl cellulose, the subsequent formation of a cohesive gel was effective in encapsulating large population of potentially contaminants like bacteria or in potential infective organisms like bacteria under the gelled surface, as well as being immobilized within the swollen fibers. In these pictures, you will see how the bacteria are trapped and then how they are immobilized when it's transformed into a gel. Another thing, I must mention that there are other studies to determine the role of carboxymethyl cellulose with silver when it's mixed with silver in infection control, in prevention of infection, but these studies are very inconclusive whether it is the silver ions that help or the carboxymethyl cellulose itself or neither of the two. It is a good, I'd say it's a good subject for future research.
So next time you have Aquacel AG, tried hydrophilic dressing, or any kind of hydrogel in your hand, now you know that you're holding a product that contains carboxymethyl cellulose. And now you know what is it for. If you learned something today, please do not forget to like, share, and subscribe because it does help this channel grow. Have a great day. Thank you very much, and God bless.